Next up is Voices of Change with your hosts, Leslie Acosta and Aissia Richardson. Voices of Change is to connect, inform, and empower people to engage in social political change. Right here on USALA Radio. World news, local politics, saving money and investing, all this and more right here on USALA Radio. Your voice, your radio.
This is Aissia Richardson, and I'm here with some guests for Voices of Change today. Voices of Change, as you know, is usually brought by me and Leslie Acosta. Leslie's out today, so we're going to hold the fort down for her. Our guests today are Lisa Rhodes, chairwoman of the PA Democratic Black Caucus, Denise Rhodes, educational administrator and consultant, Dr. John Cruz, MD and MBA, and we're going to discussing COVID-19, health disparities, and environmental justice, reopening the state too fast, and Senate Bill 613. And then we're going to also talk about our new normal post-coronavirus society. What is our world going to look like after this virus is over and after we start to go outside? And then we've got some news about the primary, our primary changing. And then we're going to do something really fun, which we're going to call 2021 Cabinet Bracket. We're going to choose the Biden administration, and then we're calling that November Madness, sort of like March Madness. The name of the show is Race and Waste. So I am, welcome, Lisa. Lisa is a distinguished member of our electoral politics. And so, Lisa, why don't you go ahead and introduce yourself?
Good morning, everyone. My name is Lisa Rhodes, and as Aissia gracefully said, I am the chair of the Pennsylvania Democratic Black Caucus, and I also continue to sit on the executive committee. I'm proud to say that I am the first person of color to be part of the executive committee because I served as former treasurer for the Democratic Party for the state of Pennsylvania.
So thank you, Lisa. And Lisa is a trained software engineer. She's a graduate of the first historically Black college university, the wonderful Cheney University. And she's also been a federal contractor and understands what it's like to go into federal jobs and onto job sites and be mistaken for a secretary as opposed to a leader. So Lisa has developed a niche and an expertise in diversity and inclusion, and has been using that her expertise in making sure that there's diversity and inclusion on the Pennsylvania Democratic State Committee. So she created something called Deminars, which are ways for folks to be able to get together and really salute and to celebrate diversity.
Thank you.
Sure. And then we have Dr. John Cruz. And so I'm really excited to have a medical professional here because we've been talking about the coronavirus or COVID-19 as lay people. And so having a professional person here to talk about it is really important. Dr. Cruz graduated from the University of Michigan and the Brooklyn South Surgical Residency Program. And so his interests include surgery and holistic medicine, and he practiced trauma and general surgery at numerous hospitals early in his career. And so I'm just really excited to have these two very distinguished guests here, as in addition to Denise Rhodes. And Denise is a expert in educational advisory. She also has she's a professional educator, and so through all the ranks of teacher to principal. So we're going to talk about the impact of coronavirus on the educational system as well. So so I don't, how you want to start off, Dr. Rose, just talking about what your perspectives have been on what's going on with the corona crisis, and in particular this issue of the comorbidities of African Americans and people of color, and how this virus is affecting the African American community in particular.
That would be Dr. Cruz, actually.
Dr. Cruz, yeah, sorry about that.
That's okay.
Well, there's several factors. We know that COVID is definitely a more virulent process in people with comorbidities. So, in our community, African American community, Latino communities, they there's obviously a less access to care. Many patients don't even have a primary care doctor that they can call in a crisis like this, just due to the sheer lack of one-on-one doctor-patient relationship in public health systems. Obviously, diabetes, hypertension, uh, those type of systemic diseases. When someone is presents to the emergency department or has to go to the critical care or intensive care unit, the COVID-19 is just a problem that's hard to manage for many doctors. Also, critical care specialists are not is not a very popular field anymore in the medical world. So there are not as many trained and certified critical care doctors. So this virus has really hit hospitals very hard.
Yeah, I mean, one of the things that so Lisa and Denise and I were talking last night, and we talked about the issue of the health disparities, and how the issues in the African American community are the preventable diseases like diabetes and hypertension and heart disease, and but so it's almost like it's our fault. It's our fault that we have these comorbidities, and so but the issue is that we're living in areas where there's toxic waste, right? And we're living in areas where we have jobs that are really high stress, right? And so it's not our fault that we're living where there are higher incidences of waste management, or close to where there are trucking depots, or close to highways where there are off gassing, things like that. So
Yeah.
so I really want to figure out how we can change that narrative to talk about the fact that there are preventable, but we're in areas where we can't move, or we can't get a better job, or we can't deal with the trauma that comes from some of the violence that's in our community. So the crisis has really highlighted the issue of our healthcare too. And like you said, there are not people who are trained in this area, and it just is illuminating how fragile our healthcare system is as well.
I definitely want to hear from uh, Lisa and her sister regarding this issue because take for example, they've already found that many of the testing sites for COVID-19 have been in more affluent areas, and
Hmm.
maybe they can comment on this because I noticed that in the initial findings of some of the asymptomatic COVID-19 cases, they were celebrities, NBA ball players, for example, and in terms of your toxic uh, waste and landfills, it reminds me of the big landfill that was put in North Carolina years ago, probably 30, 40 years ago, where they were dumping the PCBs and in a 80% black community,
Mm-hmm.
poor community, and it points to a need for legislation or more legislation and funding, federal funding to public health, so we can treat some of these issues just like they treated tuberculosis, just like they treated sexually transmitted diseases.
Mm-hmm. So, Lisa, in this issue of diversity and inclusion, like, some of the recommendations, some of the issues that you see that we should be focusing in on to be able to mitigate some of the issues that we're talking about?
Well, I think that one of the things, and I'm going to just go back to something you said when we start talking about, the how there is a big difference between, the haves and have-nots in this
Mm-hmm.
process. Dr. Cruz and I, we were talking about, when you start talking about getting even antibody testing, and how the closest location was Westchester. So what does, having that location in Westchester do for people in North Philly, or people in West Philly for that matter? But,
Right.
Being affluent has a big impact on your healthcare, as we already know. And, I'm going to, bring Denise in on a conversation, because this has had, race has played such a critical, very critical role in this whole pandemic. And as you know, we started talking about, Dr. Cruz and I were talking about this, how, it's all over the news about, the African American community, and how, the focus has now become on us as, the community that is in the ethnicity that is spreading the virus. But my question was, well, how are they actually reporting that? Because we've been told, numerous times that people who just, went to the doctor or urgent care for a cough, that was not tested for COVID-19, and they were labeled as having it.
Mm-hmm.
So I'm just, we're very skeptical about the validity of the numbers, but again, how many times have, some people they even said how they've gone and been diagnosed for something, and they weren't told what was on the paper. They had to read the paper.
Right.
So,
Exactly. We were talking about that exactly thing last night. Yeah. Yeah.
Right. So, when you start talking about diversity and inclusion, in the healthcare system, as you know, my father is currently hospitalized.
Mm-hmm.
And, this has been such a traumatic experience, not just for him, but for us as a family. And I've been talking to several senators about, forming a coalition, if you will, to update legislation to reflect modern times. Meaning that if the new way of communicating is going to be almost solely digital, when you talk about, communicating with your loved ones who are in rehabilitation centers and nursing homes and in hospitals, then we need to make sure that we can still, I love my medical community, and I'm grateful that they are stepping up and, to the challenge and being on the front lines. However, everybody still needs to be accountable, right? And being in a rehab facility, and not being able to contact your loved one is a problem. So, we need to introduce legislation that will guarantee us that we can actually see, whether that be from Skyping or FaceTiming or whatever, to physically see our loved ones. Because, just the fact, we sometimes forget that healing isn't just in a pill, right?
Mhm.
So it starts with your mental state. And so if you're becoming depressed because you can't have any contact with your loved ones at all, other than, on the phone, but if you can barely speak, that becomes, another issue. So,
Right.
how do we address what's going on now? And how do we also keep the numbers correct? How do we maintain accountability, and how do we communicate? So all of this needs to be addressed, not just, willy-nilly, but an actual plan, an actual legislation that, kind of makes, again, hold people accountable for their actions or lack thereof. Because that's what I'm finding, because he got sick in the rehabilitation center. He was sent to the hospital, not from home, but from the rehab center. And the whole time he was there, it's been an ongoing fight to get people to do the right thing. And we were fortunate enough to have him in a place that did allow cameras. So we were able to, monitor, his care by being able to physically see what was going on. But then what happens is when people aren't doing things correctly and not actually adhering to the quarantine rules and regulations and being careful, then when you call them on that, then if people become offended, they become vindictive, they become, anything other than grateful or accountable, right? So this has been a very interesting time. And again, we have these conversations, and, I've been trying to introduce new things at the state level, but now this has had a direct impact on me and my family. But most importantly, I don't want it to have the same impact on the next family. So I'm definitely stepping up to the plate to try to ensure that. And there are already a few legislators who agree and are offering to do just that.
Yeah, I mean, I think that issue of advocacy, particularly family advocacy, is so important. I think that we all have our anecdotal stories about advocating for our family members who were either denied care or not given the full option of care or dismissed altogether. So and I think that could be one of the reasons why African Americans are diagnosed with cancer at the same rate as as white folks, but then die at higher rates. So because they're not getting the care, the level of care is not the same unless you have like Cadillac insurance, But even if you do have like the Cadillac insurance, your pain levels are dismissed. Last night we were talking about the opioid crisis, and the Black folks being assumed don't have the same kind of pain severity, and so are not given pain pills. But now you see with the opioid crisis, it's mostly white folks that are dealing with the opioid crisis, because the impression is that Black folks don't have as much pain, and so are not given the kind of pain medication that mitigates their pain. But like we're going to be getting into a lot of issues with post coronavirus, and the horrible thing is that this is not. We're going to have a coronavirus season, right? So the virus isn't going to go away. So we're going to have to figure out, how we're dealing with these health disparities, how we're dealing with the medical facilities, the closing of our hospitals. Like, what are we going to do to be able to boost up our medical systems, but also create either ombuds people or medical navigators for folks that are going through this, so that we're not losing people. I keep seeing tributes on Facebook. It's not, people aren't just dying from the coronavirus, they're scared to go into the hospitals. So they're having heart attacks at home. They're having strokes at home. And so we're losing like so many people. And it's a reflection of the dysfunction in our healthcare system.
Mm-hmm. Absolutely.
So I feel very fortunate to be able to have conversations about my observations. And I feel very fortunate that we are able to talk to Dr. Cruz from a medical perspective, to Lisa from a technical and a political perspective, but most of my perspective is from a social emotional perspective. And my observations have been that from the beginning of the announcement of the virus, all of the interventions that have been publicized have been geared towards middle, upper middle, and elite members of society. Because when you begin talking about stay at home and work from home, the large majority of the people in the African American and Latino community don't have the option of positions that allow them to stay at home and work from home. We know that most of the blue collar workers in our society are minorities. And so they're the ones who, you know, work for SEPTA, they run the transit system. They're in the nursing homes and the hospitals as the techs and the sanitation workers. They're the EMTs, the cleaning people. So they don't have the option of staying at home. As I'm out and about, primarily trying to do things for our dad, who Lisa indicated was in rehab, I noticed the disparity among even the precautionary measures that were taken in the supermarket. In the suburban areas and the more affluent areas, they have the carts that are sanitized. The stores have markings for social distancing, both inside of the stores and outside of the stores. You see the people walking around with masks and gloves. However, in the inner city, there's no one at the door to sanitize your cart before you go into the store. I have not seen markings outside of the store that indicate the 6-foot social distancing requirements. I don't see people walking around with masks and gloves. We had a request from one of my dad's caregivers for some gloves because she said she was unable to ride SEPTA without gloves. So in the inner city communities, where are people who don't have access to basic things like food supposed to get gloves and masks?
Right.
The corner store, the corner store doesn't carry gloves and masks, and a lot of them don't understand how to navigate Amazon and go online and order things. We were delivering food to senior citizens and people in communities where they would go to Rite Aid for bread and eggs because they didn't have access to a supermarket, and there was no bread, no eggs, no basic necessities. And so a lot of the interventions that were put in place did not consider minority and impoverished people and communities. I see, a lot of the people who are working are angry. You go to the store and you try to order some, I'll say, soul food, and the people are just angry. And, we don't have this, we don't have that. So while I understand their frustration, it's not right, it's not good, but I think a lot of the things that happen at the higher levels and decisions that are made trickle down, and we bear the brunt of those decisions. Our folks are internalizing a lot of the anger and frustration that they have, which end up in the end making us sick. And so that goes back to the whole thing about the comorbidities that we have. A lot of them aren't necessarily initiated from a medical perspective, but from a social emotional perspective, from internalizing so much stress and anger that generates from society.
Yeah, I mean, I would agree. I mean, I'm one of those people who yesterday we ran out of eggs and I went down to the Rite Aid, I mean, I'm like, I had to put a prescription in. So, I mean, and people have been castigating me and saying, don't go outside. You should just, order all your medication online, order food delivered to you. Well, that's cost, right? There's a cost to that. There's also there's some people who have already been doing that because they can afford to do it. But when I got down there, they didn't have any eggs. They didn't have any bread.
Right.
They don't even have dish detergent. And so you can see where our supply lines are cut. You can see where our products are being produced. And a lot of our products are being produced in China. And so some of that stuff is sitting on docks in China waiting for inspections or waiting for tariffs or what, and so we have a president who has been so anti the world, anti-global, and America first, and now it's America last, right? We're gonna get our supplies last because we have a president that hasn't been able to navigate the world stage and started out calling this virus the Chinese flu,
virus,
right? And so now we don't. So and all the Chinese restaurants have closed down because they were being harassed and people were taking their frustrations out on the wrong people. The people who we should be taking our frustrations out as a national government that waited 2 months to respond and put people like Dr. Cruz in danger because we didn't have the supplies, we didn't have the PPE, we didn't have the things we didn't have a robust healthcare system that could deal with a pandemic. So, I mean, I think that's going to go into our conversation about electoral politics and those dates that you sent me, Lisa, about the dates that people need to remember and know about our what's coming up in the summer and in the fall.
Yeah. I'm just going to close out this part of the piggyback on what you and Denise said, which is my question, and we talked about this a little bit too, is what do families do that live in a 3-bedroom or 4-bedroom row home but have 7 members in their family? When you start talking about social distancing, and we all watch the news, and everybody's kind of like glued to the news every day to see if anything has changed. We're looking at the numbers. People are almost becoming obsessed with keeping track of everything that's going on.
Yeah.
And I said, when you watch the news and you see, you're talking about the African Americans. The kids are playing on the playground. They're still playing basketball. They're still, then they showed the Latinx community, they're playing soccer and, they're not doing this and that. They're not social distancing. Social distancing is the key. So, but then they'll show the drive, right? Kelly Drive or, East River Drive, or I'm showing my age now. And you'll see everybody running, jogging and, I was like, well, wait a minute. Are they social distancing? Like, it's like, so, we haven't really talked about how the shift, because you mentioned, how Chinese restaurants are closing, but the shift of, blaming the Chinese community or the Asian community to now blaming the African American community.
Exactly.
And I think that whole concept of blame is interesting because, like, you made a very, very good point, which is we need to be blaming our, government, for not leading. We elect people and we put people in place. And I always, before we used to say, just vote. We don't care who you vote for, but it's just exercise your right to vote. I said, I will never, ever, and I usually don't talk in absolutes anymore, but I will never say that again, because this is a great example of why you need to be an educated voter. Because if you just vote, and in Philadelphia, we are notorious for being name recognition voters. Oh, well, I recognize this name, so I'm going to vote for that name. Okay, you recognize that name because that name has been in office for 20 years, so you should recognize that name. But do you know the track record, the voting track record of that person? You know, has that person actually, you know, introduced any legislation that's going to impact your life in any way? You know, like, so I just say to people now, you know, there's no excuse anymore not to be an educated voter, because we do have the ability to do a little research now without having to leave your home.
However, from the social emotional perspective, we are bombarded by so much information that it becomes a distraction for people to address issues like that are very, very important to their communities and to us as individuals. Because a lot of times it's difficult for me to sort through the propaganda and to get to the heart of the matter.
Yeah.
And, you know, even though I wholeheartedly agree with you, when we start to try to explain that concept to young people, it's becoming increasingly more difficult to get them to understand the difference between fact and propaganda. More and more difficult. And so, you know, when we start talking about voting and you say it's important for you to vote for your future, in a situation like this whole pandemic, a lot of them are saying, like, what future? Like the school district can't even make sure that we have work to work on so that we can graduate and go on to the next phase of our lives, which I just can't talk about right now because you know, I'm just so irate with the whole system and the way things have gone down. And once again, it's about access and education and being able to navigate the system. How within our own school district of Philadelphia, there are the haves and the have-nots. How the assumption that online learning could have been implemented when a very large percentage of our young people don't have access to the internet, nor did they have, and some still don't have, laptop computers.
Right.
Well, wait a minute. As you said, although I agree with you, I have issue, again, for me, it boils down to leadership. You know, if you're getting paid 6 figures to figure it out, then figure it out. Like, you know, we knew, you know, again, we had access to information, we meaning leaders, including the school district, that this was coming and that this could potentially come. So it was their responsibility at the top to figure it out, because New York, as big as New York is, I have friends who are teachers in New York. They've been doing distance learning from the beginning. And you know why? It's because they planned for it. You know, their leader said this may happen. So if this happens, what are we going to do? Why didn't the school district send out a survey to all of their parents and to all the families, asking them something as simple as, do you have a computer? Do you have access to the internet? Those are 2 very simple questions. They could have asked the kids themselves in their homerooms when they came to school that morning, and that would have at least given them some idea or some form of data to determine who had access and who did not. Because a lot of kids will say, well, I have access on my phone, but I may not have a computer. Or, you know, we could have said to them, did you know that Comcast already had a program in place, you know, for the working class families in Philadelphia? So they could have signed up a long time ago before this even happened to make sure that they had internet access, and the district could have once again, just ask one of the big corporations and, or some of the philanthropists to give a donation so we can get kids laptops or Chromebooks or whatever they're doing now. That would have been very simple. That's not a rocket science decision that could have been made to avoid the void that we now have in education in Philadelphia. Because if other large cities like New York have a solution and have had a solution, why don't we?
Yeah, I mean, in a district that's dealing with schools that have lead and asbestos, in a district that's constantly in crisis, being able to be forward thinking has been an issue. It's been an ongoing issue. And sometimes I feel like we focus more on what color Kim Kardashian's underwear is than on who our elected officials are and what they can help us with in terms of getting solutions to our problems. A lot of people don't even know who their city council person is, don't know what their city council person does, don't know the difference between their state senator and their city council person, or their U.S. congressperson and their city council person. I mean, but they can tell you what color Kim Kardashian's underwear is, which is again this issue of this entertainment piece and sort of like, doing things to assuage the masses as opposed to helping people stay engaged. And this is uniquely American. Most people across the world, they are very much plugged into what's going on at their federal, state, and local level. I mean, if and they even know U.S. politics. They know their own politics, and they know U.S. politics because U.S. politics impacts their politics too. But we're okay. We're okay with we're okay with knowing what color Kim Kardashian's underwear is. By the way, it's beige. Then knowing what the issues are and how things like Senate Bill 613 gets passed and then vetoed by the governor, because we want to be, we want to take a pill instead of like pushing through.
The Matrix, I'm trying to tell you, the Matrix, when you talk about which pill are you going to take, are you going to choose the red pill or the blue pill? And it's so easy for people to stay inside the Matrix versus to take the truth pill, right? So, but I'm still not going to let our educational leaders off the hook, because I just saw another one of the councilmen put out on Instagram last night that you can, if your Chromebook isn't working, or if you need to trade it in, or if something, you can go to the district on April 20th. I said, so if we're still working on something as simple as distribution of the Chromebook, when is the education piece going to start?
I'd like to know.
And when you talk to some of the principals, they still don't even know. They're like, well, it's supposed to be April 30th. And I'm like, okay, so I know that we went to, instead of 4 quarters, it's 3. I know we've gotten some waivers, yada, yada, yada. But the end result is, how well prepared will our children be to go to college or to start their trades or whatever once they graduate? Because if there's just going to be a mass graduation without any real accreditation. Like, I think kids are going to push through.
They absolutely will.
So now that the kids are going to be pushed through and they haven't had any true learning, instructional learning since March, right? The beginning of March. So we have March, April, May, June, 4 months. And then that's going to be that same kid that just was pushed through, and that kid is going to be my nurse or my aide or my tech. So if she doesn't know what to do, or if she's not as astute as she should be or could have been, then who's to blame?
Right.
That's not her fault. At this point, it's not her fault.
Because you're talking about a full 6-month period of no instruction. And,
Exactly.
we always talk about how much students lose over the summer because they aren't engaged in any type of learning. In the minority communities, it's more play than, instruction. Even with the distance learning and people homeschooling, if minority communities, the breadwinners are still at work, then who's supposed to be providing instruction for the students who are supposed to be homeschooled? They're not getting anything.
Right.
And that's the other thing. If we already had a system set up for homeschooling, why didn't they just implement that? Like, there's things that could have been done. And I guess you can hear how I'm just so disappointed and irate that nothing was done. That's what I'm saying. Like, if you're working behind the scenes now, it's too late. Like, you're going to give out these Chromebooks, and then what? It's left up to the individual schools to decide and to determine. Well, that means there's no oversight. So again, no oversight or accountability, because it keeps coming back down to that from the leadership, means that you just get what you get.
Yeah, I mean, I have 2 students in the school system. One is a senior at SLA, and the other one is a 7th grader at GAMP. And SLA, they already had computers because SLA they do a lot of web-based instruction. And then my 7th grader, her Chromebook was picked up, and she started doing instruction, but it wasn't consistent. So you know what I did? I called Kumon. Because I need her to have some additional outside the school district instruction, not just during the school year, but in the summertime as well. So I hate to say it, but the education of our children is we can use the school district to do the baseline. I hate to say it, but the rest is on us. And that's how I was brought up. In the summertime, I was programmed. I had Upward Bound, I had Inroads, I had my mom got me connected to everything and anything that she could. And so we didn't rely solely on the school district, but unfortunately, there are a lot of families that don't do that and they can't. They don't know how.
They don't know how. They don't know how.
They don't know
They don't know how. I was going to say, and I'm going to end with this regarding my tirade, I guess, that I went to Masterman, right?
Mm-hmm.
So I remember in 5th, 6th, 7th, even 7th grade or whatever, carrying like a load of books home,
mm-hmm.
And I start thinking about how it's right about now. I can't imagine that they didn't already have a plan, because when I went there, they were exclusive then, and they always had a plan.
Right.
And so this gets back down to
disparity.
Disparity.
Exactly.
Those same kids, the kids who are sharing a building with the SLA kids, the Ben Franklin kids, I can almost guarantee you that they have not been afforded the same opportunities that the SLA kids have been afforded.
Of course not.
And that's a disparity, not only within the system, but within the same building.
Exactly. So the issue has to do with keeping on top of the school district, making them be accountable, making them be consistent, and figuring out ways, because they'll say, and it's true, that this virus is going to impact their funding. It is, because the liquor by the drink tax, the hospitality industry is shut down. So they're looking at a budget deficit of probably about $60 million. That's what's been put out there. And so, what are we going to do to be able to not only hold their feet to the fire, but figure out ways to be able to, make sure that the resources are there so that we can continue to move forward and not just deal in crisis all the time.
Yes.
So yeah.
Well, I guess that kind of ties us back into the new dates for things.
Yes. Do you want to go ahead and announce those new dates?
I sure can. So
thank you.
We talk about, the Real ID. The new deadline for Real ID is now October 1st, 2021.
Okay.
Income tax. The new filing deadline is July 15th, 2020. Driver's licenses expiring before April 30th now expire on May 31st, 2020. And then the big date change is our primary election from April 28th to now June 2nd, 2020. So I think that it's very important that people, now that we're talking about elections and the primary and being educated voters, this actually gives us plenty of time to figure out who we're going to vote for and why. So, I mean, we have our Democratic nominee now.
Yes.
However, that's not the only election that is taking place in Pennsylvania. So people need to do a little bit more homework. We're talking about the Attorney General's race. We're talking about the Auditor General's race, where we do still have 2 African American women, and we also have one other woman of color of Bangladesh descent. So I think that needs to also be highlighted that there are people of color and African Americans who are running at the state level. We have Rosie Davis, who is out of Monroe County, and Monroe County is up near the Poconos, is an African American woman. And we have Tracy, oh my goodness, Tracy
Fountain.
Yeah, Tracy Fountain. That's from, she lives in Harrisburg and is up in Harrisburg, but she's originally from Allegheny County, which is out of Pittsburgh. And then we have Nina Ahmad here from Philadelphia, who is a woman of color. So, we're still in the year of the woman. So people are talking about, well, who should we vote for and why should we vote for them? But I think what's unique, and I'm going to say this about those 3 women in particular, we do have another woman in the race, Christina Hartman, is that the 2 people who actually have degrees in accounting just so happen to be the 2 African American candidates. Because the Auditor General office and people who have held that position are known for making that a transitional position. If you historically look back on, who our Auditor Generals were, a lot of them were just the Auditor General for one term and then moved on to run for a different office. So, I think, again, what's unique is not that we have 2 African American women running for the office, but that we have 2 qualified African American women who actually have backgrounds in accounting and who are CPAs. So, and I know Tracy actually has come up through the ranks in the Auditor General's office. So, we used to say, oh, she knows where the bones are buried. And then Rosie, who still has, clients that she works with up in New York and is, very active and, still performing the duties of accounting is interesting. And I think that the interesting twist that Nina brings to the table, because I'm also going to, mention Nina, is that she's a scientist by trade. So her analysis and her skill set and her level of detail make her bring a unique twist to that office as well. So, I think people need to keep in mind, again, do your homework and decide who you think the best person is for that particular seat. But just know that we do have 2 African American women who are running for that seat. And
so I'm gonna put a challenge out to you. This is a platform for politics, for current events, and I'd love to be able to talk to the candidates who are running for Auditor General and have you come on the show and do a facilitated conversation. Would you be willing to help me set up some additional interviews so that we can hear what their platforms are?
Have I ever told you no?
No, that's why I put you on the spot. But no, this is a great platform, and I was going to say, well, how come the Black Caucus isn't doing a telephone town hall or web-based town hall? I'm not going to put that on you because then it would come back to me.
I was going to say that's exactly what we have planned.
Oh,
I'm glad you asked. Yeah, so we're putting that together now because, as you know, there has been, so when we started the process is when Zoom started having the issue with people coming on the line and breaking. I'm not going to call it hacking because technically it really was not hacking.
Right.
And that's where I guess my technical background comes back in. I was like, well, people stopped saying that Zoom got hacked because they did not get hacked.
Right.
So so we came up with some procedures because I said we need to have a process set in place at the state level as far as how we are going to do, again, back down to how we're going to communicate in the future because and after COVID-19, right? So so I started putting that together and I'm turning it into, I talked to Sinceri Harris and, running it up the chain. So we'll probably be voting on that when we have our next meeting, which that has been also moved and postponed tentatively now until in July, in mid-July. So yes, that's coming. We are going to have a town hall meeting for the Black Caucus, and yes, I will be calling on you to participate.
I would love to. And so whenever that town hall meeting is, just let me know. We'll definitely announce it on the show. We have about 5 minutes left of the show. That went by fast, folks.
Yes, it did.
But so I love this platform. It's so interesting. It's so wonderful to hear, from folks who are out in the field, like Dr. Cruz and Lisa and Denise. But I do want to get to our 2021 cabinet bracket because I just think it's real interesting that Bernie Sanders, stepped out of the race, and now we have Biden as the Democratic, contender for the presidency, and basically he got elevated without doing anything except, who elevated him? South Carolina, and the women in South Carolina. So I want to, Lisa and Dr. Cruz, I want to hear from you guys about who you think the cabinet should be for the Biden administration.
Dr. Cruz, would you like to go first?
John Cruz for Surgeon General.
That's a very nice thought. Are you suggesting that I make a statement about who his running mate should be?
Yeah, you could do that.
Yeah, absolutely.
I have to think about that one for a minute.
Okay, so we got a punt. We got to punt back to Lisa.
Okay, I'm gonna say that I think it should be an African American woman because once again the African American women.
You mean for VP?
For VP,
not
right?
Surgeon General.
Yeah, we have Dr. Cruz for Surgeon General.
Yes, we do. We got Surgeon General down.
Yeah, so I think that it should be either Stacey Abrams. I think she would make a great VP, and that's been rumored has gone around for a long time. I think Kamala would still make a good VP. She's in the Senate. She knows the inner workings. She, so, I just think that we should think about an African-American woman. So those are my two, off the top of my head, those are my two choices.
I think that Cory Booker would be good for Secretary of Education.
Okay.
Oh, not bad.
So right. I think that if Kamala isn't the VP choice, she would make a good Attorney General.
I do too. Yeah, and she would be a good attorney.
I would go with Elizabeth Warren for Secretary of State.
Yeah.
Yeah. Yeah.
Mm-hmm. And you got to go. So who you gonna give for as far as our economy? You got to have who do we say?
Well, we said for Treasury. We said Andrew Yang for Treasury.
Oh yeah. All right. So who else do we have left?
What about Buttigieg?
What can he? What?
Homeland Security. Homeland Security, Buttigieg. Oh, we also said we would think, how about housing and urban development? We said Cory Booker would make a good housing and urban development person too.
Yeah, but
because he lived in the trailer for 30 days.
I'm going to add one person. I'd like to add one person to your thought process.
Okay, go ahead.
Okay.
While I think all of these people you've mentioned is highly qualified, I want to just play a little devil's advocate here and suggest that I don't want any chance of Trump winning this next election.
Yeah.
Okay. I don't want any voters to not vote for Biden because of who's on his ticket. Just for this election. I don't care what happens 4 years from now. So while I think Stacey Abrams, all of these people are wonderfully qualified, I don't want to risk that what happened in the last election when white women abandoned the Democratic Party and voted for Donald Trump. So I'm going to propose that Steve Bullock out of Montana be Biden's running mate. Now that may not happen, but I want to erase all doubt that Trump can pull off another election just because he's been signing these stimulus checks in the community. Because I can see, Mookie and Rayway saying, you know what, I got Trump gave me $1,200, so they may not vote, but I don't want any chances of this man being in this White House again. So that's the way I'm looking at it. That's the angle I'm coming from.
Yeah, I mean, I think that there is a lot of fear coming up in this election. And, one thing productively that I would like to say as we close out, because we're at the 10 o'clock hour, is that, Lisa, we need to advocate for you to be on the Biden transition. We really need to get you on that transition team because your voice needs to be heard. And so I would support that. I would support someone of your caliber being on that transition team to be able to make sure that our voices are elevated.
Yes.
How will we do that?
Power concedes nothing without demand. It never has, it never will. We demand to have Lisa Rhodes on Biden's transition team.
Oh, well, I thank you. And if the campaign calls, I will step up to the plate and do just that.
The campaign isn't calling you. We are calling the campaign. I am calling on the Biden campaign to put Lisa Rhodes on the transition team.
Absolutely.
That is my final word.
Oh, thank you so much. And we're going to speak that into existence. I, Lisa Rhodes, accept and will advocate.
There you go. Thank you very much. Thank you for accepting that call to duty. And we got to end on this, but I love this conversation. Lisa, I'd love to have you come back. And thank you so much, Dr. Cruz, for your service and your being on the front lines. We really appreciate all you're doing.
Thank you.
So thank you so much for joining Voices of Change. I'm Aissia Richardson. We'll see you next week.